Good morning, everybody. John Thompson here with Comunidad Connect. Today is April 13th, and we have the pleasure of spending some time with Dr. Jason DeCaro and Kohl Dothage. They're both from the University of Alabama. I'm going to ask them to introduce themselves. I've known them for more than several years. We've collaborated on several different projects, primarily in the community of Los Robles in Nicaragua. So good morning, Jason and Kohl. Thank you for being with us today.
Good morning. It's a pleasure.
Yeah, likewise.
Can
Want to start?
Yeah, Jason, can you introduce yourself? Your title is Biocultural Medical and Psychological Anthropologist. So translate that for...
Absolutely. Sure. So I'm a professor in the anthropology department, and my area of research interest it focuses on human development across the lifespan, especially but not exclusively focusing on children. Often my work focuses on children within their broader contexts, and so, for example, child development within the context of a household or in the context of school, and so forth. And so my area of focus is on how culture, social experiences, economic factors, and other contextual factors, household structure, community structure, etc., how these get under the skin, as you might say, in order to shape the development of children and other members of the household, and ultimately to drive differences in well-being, a variety of different types of well-being, physical health, mental health, social development, educational progress, and educational development, and so forth. And so I've done work then, of course, with you folks in Nicaragua. I've also worked in the Southeast United States and in Tanzania.
Wow. Awesome. Well, the world needs more people like you. Thank you for all you're doing. For sure, it's been an invaluable resource to have you and your team in Los Robles with us, working with Comunidad Connect and some of the health promoters and our local partners there. Kohl, I know that you have spent several summers there embedded in the community doing research. Tell us a little bit about yourself. You're at the University of Alabama working towards your Ph.D.
Yeah, so I'm a PhD student in biocultural medical anthropology. My work, broadly it fits under the umbrella of maternal and child health. So I'm interested in the mental and physical health of mothers and their children, but I have a specific focus in exploring how mothers in particular manage stress. How do they navigate, really stressful situations, daily stressors, particular, moments of adversity. And then trying to identify the strategies or resources that might allow some to withstand adversity with, fewer negative effects than others. We typically refer to this as resilience, right? So these negative effects can be, mental and physical health problems. They can be social effects. So, negative effects really broadly defined.
How did you get started with your research in Los Robles? With Comunidad Connect, there's a large team. There's a large collaboration of people who are professors and students who have really dug into maternal and child development in Los Robles. Started years ago. I believe the longitudinal study began 4 or 5 years ago, if not longer, with Dr. Warren Wilson. We hope to hear from him next week as well. But can you tell us, maybe starting with Kohl, can you tell us how did you get to Los Robles and what did you do? Tell us a little bit about the collaboration.
So I initially came into the program at Alabama with an interest in working in Central America. my initial interest was actually in Guatemala, but Jason here told me that he had some really awesome connections in Nicaragua with our ties to other universities in the research group and with Community Connect. And so in the summer of 2017, we decided that I would take a preliminary trip to do a pilot project and kind of get familiar with the country. That initial project was looking at issues with food insecurity and fair trade, participation in the fair trade market with coffee farmers. Although that project kind of fizzled out because I became interested in some other things that I saw while I was in the community, right? So
Right.
my research focus changed, but I do recall that, the experience was really, how do I want to say it? Magical is kind of an exaggeration, I suppose, but it really exceeded my expectations. I had never traveled abroad alone prior to that. And, CC really kind of smoothed out all the creases, right? Made the in-country travel and housing, kind of there was less of a headache involved than I would expect in getting to this kind of remote rural community. So, I've been happy to partner with you guys ever since.
Well, likewise. Los Robles is a very special place. It's been a part of my life since 2007, and it's been part of the experience of Community Connect since shortly thereafter. Probably around 2009 or 2010 is when we started working around increasing the access to clean water through water filters, education, and follow-up. And we had the chance, have had the wonderful opportunity to work with local health promoters called Brigadistas in Nicaragua. This is a community Los Robles is a community of about 2,000 people, 450 households. And there's a number of incredible local leaders, mostly women, that are the boots on the ground. They're advocates. They can help with referrals. And I know the work that you did included a number of surveys, both with them and with mothers in the community. Jason, take us out maybe a little bit to the 10,000-foot view. How did you get involved here? I know some of your colleagues from University of Calgary, Ohio State. Again, this is part of a larger collaboration. Can you tell us a little bit about how you got started
Sure.
in this work?
Absolutely. So I got started really through Warren Wilson,
Mm-hmm.
who you mentioned earlier. So he and I had already been collaborating for several years on other projects. And so we worked together in Tanzania, for example.
Okay.
And that was really where we started our collaboration, also looking at questions related to maternal and child health in a large urban center in Tanzania, the city of Mwanza. And I was spending a good part of a summer in Tanzania as part of that ongoing research project, and during a sabbatical that I had. And at the same time, Warren had begun his work in Los Robles. And so he suggested, since we'd been working together, and because there were a lot of conceptual similarities between the kind of work that he was doing and what we had done and what I was doing in Los Robles in terms of looking at some of those factors on the community and household level that might shape child growth and child well-being. And so he suggested that toward the end of the trip, rather than go straight back to Alabama, that I might come and visit Los Robles for a couple of weeks. And so it originally was a sort of add-on to a pre-planned research trip, really blossomed into something very special. And so since then, I have only been back once. I returned just a few weeks ago, just in early February, for the Health Summit, which was a wonderful opportunity to spend some more time there. But during that first trip, I met the Brigadistas. I got to get some sense of what Los Robles is like as a community, met many of the really wonderful folks. The clinic there had just recently opened, and so I was able to see the clinic in operation, and meet the Community Connect team. And it became clear not only that there was an opportunity to do some, what I felt was potentially very important research related to community health in Los Robles, but also that it was a setting where there was a potential for an opportunity for to have a significant impact. In fact, in many ways, it seemed, with the team that was there, the collaboration on the academic side, the Community Connect team, the Brigadistas, everything that was going on in Los Robles, that there was not only a need, but that there was a special opportunity to have avenues to contribute toward improving the well-being of the community in a way that I had not felt in some of the other contexts where I had worked previously. And that's when my international work really directed towards supporting that collaboration with Warren and with Barbara Caparata at Ohio State University, toward seeing what we could come to understand about maternal and child health in Los Robles and how we might be able to contribute to the future design of health interventions.
Yeah, I agree. I think it's a real special confluence of interest, expertise, and positioning, right? Because
Yes.
we do have a team on the ground, a Community Connect staff, their local partners and volunteers that can take the findings from your research, from our research, and put them into some practice.
Yes.
We can pilot initiatives, we can develop programming. So there's some really important, and I think special, to use your word, human resources that have been galvanized, that have been catalyzed over the last few years, that I think when we were together in Nicaragua just a few weeks ago for the 5th annual Community Health Summit, I was reminded of the power of this network, this community that has come together from the academic space, from kind of the nonprofit or the NGO space, and then also on the grassroots. From the grassroots, the grass tops to the to the classroom, and it creates an incredible synergy. And I think we're now at the point where we have some preliminary findings. Certainly have a lot more data to collect and to sift through, but tell me a little bit about what you're hopeful for, like in terms of this research. What do we know now that we didn't know before? And then maybe we can ask Kohl, because I think she's the next person slated to go down and continue the research about what the next steps are. But just briefly from your presentation in Nicaragua just a few weeks ago, there was a number of findings that I think are pointing us in the right direction to work with women and children, so that development, healthy and I don't know, proper development, if you will, we can support that. Can you share just a few tidbits that kind of resonate with you regarding the research and what that tells us about the community?
Sure. So I think that one of the things that we have been able to see is that the Brigadista network is a tremendous resource for reaching reaching households throughout the community and providing support toward improvements in health. And I think it was really, inspiring, frankly, listening to the brigadistas when I was there in early February and listening to them talk about some of the improvements that they have seen in terms of, for example, areas like infectious disease control, and some of the efforts that have been going on in order to try to improve food security for the households that are in the greatest need. And so, that some of those acute health and security issues, of course, also the improvements that have been going on for a number of years with respect to water security, right? They provide an opening to now also look at some of the issues that are harder to grapple with when you're dealing with something like a dengue outbreak, right? But which have important long-term implications for the health of the community. And this is where a lot of the research that we've done has on some of the issues related to chronic health. And so we, as is so in communities, undergoing what's sometimes referred to as the nutrition transition, change in nutritional practices that has come with globalization. We see evidence for a lot of risk for chronic health conditions such as diabetes and hypertension. But it's also important to emphasize that a lot of that risk is in the categories of pre-hypertension or pre-diabetes, right? And so on one hand, this is, I believe, a really important thing to try to find ways to address, because the risk is there for a increased number of folks over the course of the coming years to develop chronic disease conditions. And yet at the same time, there's this window of opportunity as some of these other more sort of acute health conditions in the community have been brought under control thanks to the energetic efforts of the grassroots, as well as the support of organizations like Community Connect, to make sure that that chronic disease doesn't need to sort of take its place as a major health problem in the community. And I think that's really one of the key things that I hope research can contribute to, is identifying some of those areas of risk and opportunity to intervene before it gets to the point where chronic disease has a greater impact than it does at present.
There's, research is, I don't know if it ever stops, right? Particularly in your wheelhouses. Kohl, you're set to go down. We were thinking this summer, probably going to push that back a little bit, I assume. But, you were there last summer. Tell us a little bit about what you did then, and what you have slated for next steps in Nicaragua.
Sure. So last summer, I was down there with the goal of kind of resampling some of the the women that we had previously interviewed in the 2015 survey. We were interested in seeing what kind of changes might have occurred since 2015, and then, identifying particular areas of need going forward. So I interviewed 41 of the original women in this 250 household survey. We did interviews that looked at household food insecurity, household water insecurity, an assessment of maternal mental health, and then some assessments of physical health of both mothers and children. We've discussed some of those preliminary results at the health summit, right? I'm sure that we'll, in a different episode, we can get into those more if need be.
That's right.
But hopefully going forward, we'll continue to finish up the data collection, get as much as to our the end that we had hoped for as possible. And then kind of the practical goals of the project as a whole. I think that in addition to what Jason had mentioned as far as identifying points of intervention, I would love to be able to collaborate with folks in the community to work on ways of translating our findings in a way that makes them very meaningful to folks on the ground, right? There's sometimes a disconnect between the perspective of researchers and medical experts and the things that really matter to like mothers living in Los Robles, right? Finding ways to translate those findings so that they, they're meaningful to them. And then my research in particular, like I noted earlier, is looking at what are resources or strategies that some folks use to be able to weather the storm. Can we identify those resources and those strategies, and can they be offered in a way to offset some of the effects that daily stressors might be having on folks in situations where, eliminating the root of the problem is just out of reach, right? Poverty is a big problem, but our team doesn't really have the power to eliminate poverty in rural Nicaragua. So what can we do is a sort of, harm reduction measure in the meantime.
Well, it's a great segue. Obviously we have a big storm happening right now worldwide. The coronavirus pandemic is something that we cannot solve. It is a matter of just mitigating the risks as much as possible. As you both know, Nicaragua is one of the few countries, if maybe the only one at this point, that has not made sweeping changes to social distancing. Schools are still open. Holy Week was last week, and the country was invited to go to the beach and vacation and get together. And these are some challenges that are unique to Nicaragua, but they are challenges that we here in the States are trying to manage as well, right? There's some people that are doing it more than others, and so there's a real it's a big uphill climb right now. And when we talk about resilience and how families have implemented strategies, whether they intentionally or not, they have been able to live and survive and even prosper in some cases in communities like Los Robles that are very resource poor. And given your knowledge of Los Robles, your time there, the context with which this research contributes, what kind of in the context of the coronavirus pandemic, what is most concerning, and or what is most reassuring about Los Robles in the weeks and months to come?
I guess I can start on that one.
Yeah.
I would say my concerns are twofold and kind of depend on how things pan out, right? I think that if the community is hit hard by the virus, it we might have catastrophic consequences on our hands. You've got many people suffering from the sort of conditions that we know put people at greater risk for complications from COVID. Access to healthcare is uneven. And I mean, like it was for most of the rest of the world, Nicaragua had, very little time to prepare to get the sort of medical supplies needed. I read a report from MINSA from back in February that said that Nicaragua had something like less than 200 ventilators available, and 80% of them were in use, right?
Hmm.
On top of that, Nicaragua was likely being outbid by richer countries for, access to kind of the short supply that we have of mass of testing equipment. So things are going to be tough.
Yeah, that's true.
That said, even because Los Robles is, a little bit more isolated, it might be protected from the spread to a certain extent because of how rural it is. There's going to be, long-term economic consequences that are going to make life even harder. I'm thinking about, for example, things that we've seen in other economic downturns that Nicaragua has experienced. So difficulty for smallholder farmers to get credit to survive the year, or downturns in profits for larger farms that provide wages for day laborers in the community as well. So I think that things are going to get tough even in our best case scenarios, right?
Agreed. We we often try to reach the most isolated and most vulnerable families, whether they isolation from social supports, isolation geographically, isolation from access to healthcare, jobs. It's quite a puzzle, and there are a lot of pieces to try to put together. We do not have all the pieces. But you and Jason and the rest of the academic community that is with us, and with us I mean with Community Connect and the communities of Nicaragua and in the Dominican Republic that we work with that are really struggling right now. Jason, turning towards what we can do. I think you both were mentioning food security. Our Food for Good program currently provides meals for several elderly people that live alone, families that have special needs, patients within the household. We're looking to ramp that up, and some of the findings from your research have pointed us into directions of how do we address this nutrition transition so that when we do create jobs and access to food security, making sure that we're doing it in the right ways with the right food sources. And so you both know we are beginning to plant the seeds of a larger initiative to grow crops, basic grains, corn and beans, and not just deliver foods, but also get into the production, more larger scale production of foods that are not only have some nutritional value, but also are within the cultural norms of the community, which we know can be quite tough to overcome. In addition to what Kohl was mentioning, Jason, do you have anything to add regarding, concerns or reassurances about life in Los Robles going forward?
Well, I feel like Cole captured well many of the things that that I might have said. I think a couple things that I would add that really build on those same points are that these efforts to maintain and, if possible, enhance food security are not separate from the issue of combating infectious disease like the coronavirus. We know that those who are most vulnerable from the standpoint of nutrition are also typically more vulnerable to susceptible and susceptible to vulnerable to more serious complications of infection across a wide range of infectious disease. And so these efforts are entangled, right? We simply the efforts to make sure that people are as well nourished as possible are part of what makes a community more resilient. When whether you're talking about sort of this sort of constant every year endemic diseases
Mm-hmm.
or epidemic diseases like this one that sweep through. And then so there's then a short-term and a long-term dimension to that. And I think, there's a great deal of value at the same time to, in the immediate term, making sure people have the basic calories and nutrients. And then over the long term, developing programs like the kind you're talking about, which allow for the development of the most stable possible base of local food production in, as you rightly put it, in a way which is culturally appropriate, foods that will be acceptable and can be used to make dishes that that people know or can learn how to make. And I was talking about earlier, while on one hand, I talked about how work to control infectious disease has helped, open up the space to think about chronic disease. It's also important to recognize, particularly in the context of an epidemic like this, and Kohl hinted at that a little bit earlier, that we know that those chronic disease conditions, like hypertension, like diabetes, are exactly the same ones that make you more vulnerable to severe COVID-19 disease. We also know that another thing that I didn't explicitly mention earlier, but that, as you know, the team has been working on, is understanding mental health within the community, and supporting mental health is all the more important during a time of heightened stress. And I think many of those of us living here in the United States have experienced the way that the pandemic has created entirely new types of stressors and heightened stressors that already existed. In many cases, making mental health challenges more difficult. And while the situation on the ground in Los Robles might be a little bit different than the situation on the ground in Tuscaloosa, whether it's the direct effect of the disease or the indirect effect through, for instance, the economic catastrophe that has been unfolding across the world. Being able to attend to mental health under these conditions is very in the short and medium term as people deal with that heightened stress. And so we can't do everything at once, but these are all interconnected, and I think need to be as much as possible on the radar screen as we look toward not only the next few months, but the next few years, what are likely to be some of the sort of the interconnections between COVID-19 and some of these other issues related to vulnerability and well-being.
I'll tell you, it's I've been working in Nicaragua for over 20 years, and I am always amazed at how people, families, with so little resources, with such a bleak outlook as far as opportunities and access to basic services and products, how they have nurtured a sense of, I don't know how to call it. It'd be, uh, because I don't want to say happiness, right? Because that's too general of a term, but um, we are struck in Nicaragua by how kind and warm and welcoming the people are, and given their the level of poverty that they are faced with every day, um, their resilience, their solidarity with each other and with others that come into their community has been one of the strongest inspirations for me in my work and life, since Nicaragua came into my life. And we certainly have a lot to learn from communities like Los Robles. I think we have quite a bit to contribute as well. As you both know, a little bit goes a very long way in Los Robles. And as we find our way forward in this new era, um, we we know that it's going to take a lot of work and a lot of collaboration, because none of us have all of the answer, but we each have a little piece. And so I just want to appreciate and lift up you two as people, as excellent research partners that are really contributing to the improvement in the quality of lives of those most vulnerable. Because I believe what we're doing in Los Robles has a lot of applicability to other communities, and not just in the global South, but also in our own communities here in the United States. So thank you for your time, and thank you for all your hard work. I hope that we can reconnect in the next week or two to share some more of the findings and research that you both have been doing independently and collectively. And perhaps we can invite some of our other colleagues from that same research endeavor from the Ohio State University and University of Calgary to join us. But again, thank you so much for your time and for your contributions. I want you to stay safe, and I hope we can see each other soon.
Likewise, it was a pleasure.
Same.